Well, good afternoon, everyone, and welcome to the first RSL and Services Club's webinar brought to you by Max for this year, for 2021. We're glad to have you all with us, and I'm certainly pleased to be able to welcome three excellent presenters today on our topic, surviving a COVID cluster. And as all of us have observed over the last few months, a number of our venues, club venues and pub venues, have been listed as sites where positive COVID cases have visited, and therefore the clubs and the venues have to go through a whole range of processes and steps in response to safeguard their customers and their staff, and to be able to reopen and offer their services once again. Excuse me. So today we've brought three speakers along to give you a lot more information and detail about what to do, what your requirements are, what your procedures are, and what does happen after this happens, and what you need to do to rebuild your customer confidence and your patronage at your venues. And I remind you all that at the bottom of the screen is a box where you can press Q&A. If you have a question for any of our speakers, please use that box to type in a question, and I'll see that question and then I'll ask the presenter or all the presenters, depending on who you're wishing to answer that question. So today we've firstly got a team leader in the compliance division from Liquor and Gaming, Rebecca Riley. Rebecca did speak to us earlier in the year about some of the COVID safe requirements and the COVID planning. And in the last few months, she has had responsibility for compliance and looking at venues and how they are responding. So Rebecca will be speaking, and following her will be two of our club CEOs who've gone through this process themselves. Darryl Hunt, the CEO of the Mounties group, who had a number of his venues unfortunately impacted earlier last year, mid last year, and Darryl from Milton-Ulladulla, who also had experienced that process in his own venue and some of the lessons that they learned from it. But firstly, I'd like to welcome, and I'll firstly take my slides down and invite Rebecca to load her slides up. And welcome to Rebecca Riley. We very much appreciate getting this advice and information from the department. It helps us and helps our venues to understand what they need to do. So Rebecca, please load up your slides.
Thank you. Just give me a moment. How's that?
That's good. Thank you very much.
Okay. Thank you for having me. So obviously today's topic is surviving a COVID cluster, and what I've been asked to speak about is, I guess, obligations that the venues do have when they're notified by health that they've received a positive case, what they need to have in place and how they how they need to act. I'm sure our other speakers are going to touch on, I guess, the hygiene side of things, the staff and patron side of things. So I'm going to focus my presentation on the importance of accurate record keeping. That's certainly one of our key focuses from a compliance perspective at the moment, is ensuring that venues have watertight record keeping, so that when the time does come, if you are notified and need to produce those records, or health need to tap into your records, that you're ready to go. That's one of the things that New South Wales has sort of done very, very well over this period, is our contact tracing has been very, very good. And as I'm sure it'll become apparent, that there's nothing a venue can do to stop someone with a positive case walking through those front doors. But what's setting venues apart from the ones where it comes and it leaves as quickly as it came, and those that really suffer, is how strong those processes and controls are while things are going well. So that's how I'm going to focus my what I'll focus my presentation on. Obviously, the information and advice given is just current as of today. I did check the presentation at 11 o'clock to check if anything was released that might impact the presentation, but all of the record keeping things are relatively the same. So just moving through here. So as you're aware, under the current public health order, every venue needs to have a COVID safety plan. Now, we're up to, as you can see down here, we're now up to order number 7, amendment number 5, and really appreciate that these are changing so often, and it can be quite hard to keep up at the moment. So what I've done is I've also popped a link down there where you can always access the most recent COVID safety plan. So as it stands today, the current COVID safety plan should be dated the 29th of January version here, based on the amendment to the public health order last Friday. I made this presentation last week and I had to check it and change it this morning. That's literally how often these things are changing. So just keep up to date with those plans. Now, one thing that didn't change was the requirement that at the moment, all venues are required to be doing their record keeping through the Service New South Wales app. That's outlined in the COVID plan. So these are obviously your 4 areas here. Last time I spoke about the hygiene and cleaning aspect, but today we're going to focus on the record keeping. So the Service New South Wales QR code has been mandatory since the 1st of January. And what this does is this has taken the pressure off venues from having to produce their own records. What we were seeing is there was just too many methods out there. Some people were collecting them manually, some people were using in-house systems, some people had set up laptops with spreadsheets. And we did find that, the New South Wales government found that that was slowing the process down. So what they've done is they've made it mandatory from the 1st of January 2021 that all venues are required to have this. But because the back end of this code is managed by New South Wales Health, it's really important that on the front line, this information is collected accurately. And I'm going to step through how that can be done and just some things that we've seen regarding non-compliance, and also some really clever things that a lot of venues have put in place to ensure that this is happening. Because that's the one thing that your venue can do to assist when that positive case comes up, is to be able to know that your records are accurate and are going to be able to effectively help New South Wales Health. So this is the snippet here from the actual legislation. So that's your responsibilities under the actual public health order in relation to the app. Sometimes I find that it does help to arm yourself with that section and to have an understanding of the legislation, because as with anything, your patrons are going to try and challenge it and the requirement to do so. So if you can kind of back yourself that it's a written law and take some of that pressure off, I always find that if staff are kind of armed with that information as well, that they're able to pass that on. And if you can provide people with a really, a proper, full reason as to why they need to do something, sometimes that can help manage that relationship a little bit. So I'm sure most venues, I certainly hope most venues have got that QR code and know how to obtain it. One of the important things that I wanted to discuss here is the ability to not just have a QR code once you're registered as a COVID safe business and have that COVID safety plan, but also the ability to have the New South Wales Service New South Wales check-in web form. Now, this is how you are going to be able to assist people that don't have smartphones or struggle to use them, people that might not have, the app on their phone. Your venue is still responsible for using this app. So I'm going to speak more about that web form coming up as well. So you can obtain both the QR code and the web form from the New South Wales government website. So the importance of accurately checking in, obviously you need to download and display your unique code. Now you can't alter that poster in any way, because as the way that those QR codes work, that's to your venue, and you need to display that QR code where it's easy to see and easy for customers to scan. So it should be at the entry point. We also see them, a lot of venues at the moment have check-in stations. I know with your clubs it's almost perfect because your patrons are used to going through those sign-in terminals. Also, you can have them on point of sales, you can have them on menus. Also be mindful if you do have a venue that might be split into different zones, be mindful about where you put those codes. And the third point here, I guess, is the most important, is that you need to confirm that your customer has successfully checked in. You need to look for that green tick. So it's not just enough to say, yep, we've downloaded the code, we've printed it up, we've stuck it up on the door. You need to be able to demonstrate that you have controls in place, that your staff are checking that people have accurately signed in. It's a bit different now that we've got the app. Back when we just had those regular QR codes, we were hearing stories of people that were, signing in with all sorts of names and phone numbers. We had people that were showing screenshots on their phone of the green tick. People had set that confirmation screen as their wallpaper on their mobile phone, and they would just sort of flash it as they walked into venues. And I'm sure that seems really, really funny at the time, but it's really, really hard for venues that when they are hit by this to try and, do the right thing on their end when you've got people actively trying to go around the legislation. So this app's made it a little easier, but still you want to demonstrate, outline that in your COVID safety plan, because that's one thing that inspectors are likely to check, is that you've got something written in that COVID safety plan about how you're safeguarding yourself from that, that kind of sign-in issue. So your staff have an obligation to assist patrons with checking in. Not everybody is able to do this very well. There's multiple ways here you can see on one side that you can. Most of us just come in, take the photo on the app, and it's quite easy because all of our details are already connected. Some people might need to use that web form. That can be done on a computer or a tablet as well. There's some live links here that I've included. I'll share this presentation at the end if anyone would like a copy. So you've got the links which provide a little bit of advice for people who might be new to this. I feel like people are starting to become a little more familiar, but just there's a couple of interesting links down here which provide a bit of advice. There's also just some brief information here about how you can assist your patrons by utilising a mobile, a tablet or a laptop. I'll discuss that on the next slide about the issues that we see. I don't probably need to run through each of these steps. A lot of it's quite self-explanatory, but I guess it's just to emphasise the importance that it's not enough just to say, well, our patrons don't understand how to use this or our patrons don't want to use this. You need to be ensuring that your staff are trained in a way where if option A doesn't work, they know how to assist them with option B. And if option B is not an option, they're also equipped to be able to handle it with option C. And that's what we want to see. So the non-compliance in the field. Now, we see this all the time. I've heard almost every excuse under the sun as to why people aren't utilising the Service New South Wales code. I've had patrons are old, patrons don't have a smartphone, I've got no data, I don't want to, the government's tracking me, absolutely everything. At the end of the day, all of that's fine, but you as the, as the secretary or the licensee or the business owner, that comes back to you. So your patrons, if you're able to provide them with the right assistance, you're still able to kind of navigate this. Now, it's really, really challenging. But that's why this web form has come out, because not everybody has the phone and the app and are able to fill it out. So that web form will allow you as the venue to enter in the patron details on their behalf and ensure that you're collecting that, which also provides you with a really good opportunity that if you are manually filling that in, you're checking ID, you're getting phone numbers, which also helps mitigate the risks with people filling out those forms with false information. I know I've seen a lot of venues that actually take your ID and fill it in for you and ask you for your phone number just to safeguard themselves, because they really, really do want to make sure that they're gathering that. A lot of venues have adopted their own policies that you need to present identification as part of this process. So just a couple of tips that I've got here. Have staff check patrons in on their own smartphones or a designated work smartphone. Invest in a small tablet that can be kept at the front of your venue that staff can use to assist patrons to check in upon entry. Explore some Wi-Fi options. A lot of clubs have Wi-Fi in them. We've seen a lot in cafes and restaurants recently where they're utilising the shopping centre Wi-Fi. But if all else fails at your venue and you don't have that and you do need a way to, use that data, those small portable Wi-Fi dongles can also be explored. Also with that web form, you can have a laptop set up at an entry point whereby staff can manually enter those details into the web form on the patron's behalf. So instead of running through the app, they can fill that in. So you've just got to be flexible and you've got to try and find a solution. I mean, we're all changing, we're all new at this. Week by week it changes on our end, it changes on the venue's end. So I can only imagine how frustrating it is for the patrons as well, especially the regular ones especially if you've got an older demographic. They're getting quite frustrated with the process, but I guess it's all about how we handle it to be able to assist them. Now, this has become a real concern. I would love to show you slides and slides of some of the sign-in registers that I've seen over the last couple of months during my inspections. Obviously, I can't because they've got everyone's name and contact details on them, but some of them you can't even read. Some of them have, you know, scribble over them. Some of them are deliberately so illegible that you can't read them. And that's why these have become, these have been phased out, manual sign-in records. Now, we still see them popping up everywhere. It's important to check the legislation about when these are permitted. These have not been permitted since the 23rd of November 2020. Now, it does say that if unexpected circumstances pop up that prevent the use of electronic methods of collection, such as an internet outage, any paper records must be entered into an electronic format, such as a spreadsheet, within 12 hours. Now, this means having a genuine reason why you were unable to obtain this electronically. The excuses from the previous slide, you know, patrons don't want to do it, they don't like it, they're uncomfortable, they're not bothered. That's not enough of an excuse to be still maintaining paper records. These need to be entered in. There's a link down the bottom there for that form. It's really important that if in an emergency you do need to use these records, that you have a date, a first name and surname and a phone number and your time in. It should be a phone number or an email, either or, but you definitely need to have the time in and the name and the date. That's really, really crucial, and these need to be kept as electronic copies because you need to be able to produce these. One of the massive issues that we found that has resulted in a lot of enforcement action is people just putting out a notepad and paper out the front of their venue because it's easier. Your staff don't need to be bothered to, you know, help sign in anyone on their behalf. Nobody has to invest in a tablet or a phone. It's super easy to get an exercise book. But the problem is that when something does go wrong, you know, which is what we are discussing today, these manual records, when they haven't been digitized and when they're not legible and when they're incomplete, are completely useless. And it really, really does slow down that process. Yeah, I wish I could share some of the photos with you as an example, but obviously we can't. But just to be reminded that it's not to be used as an alternative. That's just, I guess, the basic record keeping compliance, things that we're focusing on at the moment. You'd be aware our statement of regulatory intent exists at the moment, especially with clubs. Just in relation to your sign-in processes, we know it can become quite onerous doing both lots of sign-in. I know I'm used to working club signing people in. I know it's quite a process. So I can imagine having both of them. So right now, as long as you're using your QR code, that's fine, but do keep an eye on that. We don't know when that regulatory intent will change, so just keep an eye out. If you do have any questions, my email address is there. Feel free to flick me an email or give me a call. And there's also a heap of frequently asked questions up on our website. The link is just there. Thank you very much.
Well, thank you, Rebecca. A comprehensive description and outline of what's required. And I mean, the bottom line is all venues have the right to refuse entry to people if they are not going to comply with the requirements that have been set. And government has set these regulations and requirements in the legislation. Venues are required to honour them, and patrons, if they wish to enter the venues, have to comply. And I mean, the basic fact is this is about everyone's safety. And yes, we don't always get our patrons understanding that,
yep.
But that is what we're seeking to do here, is protect all our patrons. And the best way we can do that is by knowing if they've been in a venue when a positive case has happened, and we can then act quickly. I think
Absolutely. I think if you turn that back onto your patrons as well, that, you know, they do need to accurately fill out their information, because it could be them that needs to be contacted. And people generally, when they think that they're at stake, sometimes you get a shift there. They'll be willing to participate if they think that they might benefit. But I guess that's the great thing about having your conditions of entry clear at the entry point, is that you're the boss of your house. And if you're not going to comply with that, well, you're not coming in.
yes, thank you. Thank you. That's very good. I might also make the point for any listeners who are not in New South Wales, who are from other states, and there may be a few. This is the New South Wales rules. This is the New South Wales government's requirements. In each other jurisdiction, you will have your own unique requirements that have been set by your governments. But the process of signing in and making sure you're checking who's coming in and that you've got a record of who's in is, I think, a requirement in all the jurisdictions in Australia, but the process might be different, but the requirement is the same. All right, once more, thank you again, Rebecca, for that excellent presentation. It's now my pleasure to welcome Dale Hunt. Now, Dale very kindly stepped in at the last minute because we originally advertised that Christo Tracy, the general manager at Avalon Beach, was going to join us, but he's had quite a lot of things on his plate, and he's had a couple of issues arise in the last couple of days. As you can imagine, his venue was closed for over 3 weeks as a result of the Northern Beaches cluster. So it's not a big club. He doesn't have a huge management team. So unfortunately, he's had a few pressures on him today, but very kindly, Dale Hunt, who does also have a couple of venues in the Northern Beaches area, as in his group of Mounties, has volunteered to be interviewed by me today and to discuss what the reality is when it happens for a venue. Dale, thank you and welcome.
It was good to hear Rebecca say anybody can reach out at any time to her. So if anyone's got a pen and paper, I'll give you Rebecca's personal mobile. I've got it.
Thank you. Thank you. I didn't offer that one, but so Dale, take us through what actually happens on the day when suddenly you're contacted by health department to say, gee whiz, guess what? Somebody positive has been to your venue. What did they do? What are the steps do they give you advice as to the steps you now have to undertake? And, you know, what did you have to do?
Yeah, it's funny, Gary. We've now been through 3 shutdowns as Mounties. So
Yes.
We first of all had the industry-wide shutdown. We all got that, 15 hours notice and shut your doors. And then we had the Mount Pritchard experience, where we had a phone call early one morning, and I'll touch on that in a second. And that ended up with 4,000 of our members self-isolated. And then we had the Northern Beaches cluster, which closed 2 of our venues. Every one of the experiences has been different. But the one thing I think I've picked up along the way is that whether it's New South Wales Health, whether it's Liquor and Gaming, or whether it's a club, we're all learning along the way, and we're all just adapting and trying to do the best we can, no matter who we are. So our experience from the Mount Pritchard closure was really early in the COVID phase. The pandemic had hit, we'd only just opened, and it was weeks later, not months after clubs had been allowed to close, that the phone rang one morning and we were told that we'd had a positive case visit the Mount Pritchard site. At that time, all they could tell us was he had been in on this day between this hour and this hour. Of course, I think everybody that goes through this experience probably goes through the same emotions. My first emotions was, oh shit, and you went into meltdown. I don't care who you are, how well prepared you are, and let's be honest, I believe we were really well prepared. We own a medical company where our doctors wrote the COVID plans for 2 of the major hospitals in Sydney. They wrote our COVID plan, and I thought we were really well prepared. You get a phone call and it all goes out the window. So the first thing you do is go, I need to protect my members and my people. You go back to that checklist as you would with any experience, and you start to question yourself as this is going through is, at that stage, what have I done wrong? I thought we had the cleanest venue. I thought we had the best procedures. Nobody got in this club without, you know, signing in, without doing this, without being asked specific questions. And then as the time goes on, you realise that this is no one's fault. We had a person enter our club who had been to a funeral. He then came to our club after the funeral for a visit. No symptoms, no signs, no idea that he'd been near anyone with COVID. And then, of course, he visited the next day and the next day and the next day, because we've spent 50 years building a business that pulls people in for different reasons. Tonight for a meal, tomorrow for a gaming machine, the next day for entertainment. And for some of our members of our community, our club is that place where they meet up with anyone else in the community. That's their social spot, especially in a cultural area. So the first phone call was, oh shit. The second phone call was actually frustrating to a degree, because they would then say, he's been in this day, and this day. And I'd be saying, okay, can you tell me his name? So then I can say where he's been in the club, what he's done, who he's spoken to, who he's been within 10 metres of. And they answered, no, we can't tell you who it is. And I went, okay. So they said, we're going to self-isolate everybody in your venue. And at that stage, New South Wales Health had never been through this either, I don't think. So, well, of course they hadn't. So they were doing the best they could. And I don't think they understood that to self-isolate a place like Mounties is 15,000 square metres of property. It's like closing down the local shopping centre or something. And that's just front of house. So when they rang back on the third day and said, oh, he's also been in this day, I said, well, his name is X. He has been past these people. Here are their contact details. Here's where he walked, what time he went, and which way he left to go. She goes, well, how would you know that? I said, because you gave me 3 days of the person coming into our venue, and a club is the only real place that can probably say, he signed in at this time, he left at this time, he went here, and we have CCTVs everywhere. To which the response was, we really appreciate that, but you're self-isolating everybody in the club anyway. When I then said, but our doctor wrote this COVID plan, and she went, no, you will listen to New South Wales Health, not a doctor. And you could understand later on the frustration that I had. It took me ages to realise that this was just some poor person trying to do the best job they could under pressure they've never experienced before. And all I could think about was, geez, you're making my life hard. So I guess then the third one came around and they shut the northern beaches, I actually contacted the mayor, the police, and a local member over there and said, we've heard about Avalon, we are shutting our venue. So we beat New South Wales Health to shutting down. So while it's a horrible experience the first time, the second time is damn frustrating, it gets easier. You just easier. Well, and if it does happen to anyone, I'm actually glad it happened to us early, because we do have that management team in place and the structures and the, you know, the ability to learn from it quick enough and hopefully get that message to other places that wouldn't have had the same resources.
Well, yeah, Dale, you were one of the very early victims, to use the negative term, of the fact that a positive person came into your venue and health then had to respond to that situation. I think health department's procedures have been streamlined and improved significantly, particularly with what Rebecca's been talking about with the Service New South Wales app, you know, the QR code. That's working a lot better.
I don't think it's just New South Wales Health that's improved. I know I got a phone call the Saturday morning off the local police saying, we have to go and tap on all these people's doors, and New South Wales Health said you have 120 cases. We need to go and tap on their doors to make sure they're home and they're self-isolate. And I said to them, I said, well, I'm glad New South Wales Health told you we had 120 cases, because they told me I've got 4,000. Self-isolate. And as he said to me, he said, Dale, it's Saturday in Fairfield. We're not doing it.
Yes.
The police had to learn as fast as New South Wales Health and as fast as us. I think this has been horrible first, frustrating second, they're probably the best learning experience the industry and probably the country will ever go through.
You're right. You're absolutely right. And the other learning experience that you mentioned and you stated was that the person concerned, in almost every instance, they don't know that if they had symptoms, they'd stay at home. And 99.9% of people try to do the right thing. This person who was the cause of your first lockdown, or the first subsequent lockdown, he, as you said, didn't have any symptoms. He did not know that he had was contagious and he had the disease or the virus.
I think that's all part of the adoption and adaptation we've gone through over the last 12.
Yes.
I can remember at one stage, I was joking to the president saying, look, I'm going to get COVID next week because it means I've got to self-isolate for 14 days and I won't be at work. That's a joke. It's actually become so much more serious when you look at the world than I ever expected it to be.
Yes. I mean, we're going to hear from Darryl as well shortly because he went through a process as well. And I think in September, Darryl's was, and some of the things that he's done and had to do. But can you tell me, I mean, particularly Mounties, I know the Northern Beaches one is much more recent and therefore you won't have as much data, but following the reopening, after you'd had this forced closure of Mount Pritchard venue.
Closure, Gary?
Yes, well, voluntary closure.
We were told by New South Wales Health not to shut, that our normal daily cleaning process was actually a higher standard than the deep cleaning they were instructing you to do if you'd had a positive case. And we had done 4 normal cleaning processes or deep cleans since that person had been in. So they told us not to shut. When you self-isolate 170 of your staff and you've got a pandemic happening in Southwest Sydney at that time, sometimes the right thing to do isn't the easy thing to do. And it's easy to keep your doors open and keep paying those bills. It was a harder decision that we decided to shut for 14 days. Because at that time, all we knew about this thing was the government was saying, if you get self-isolated or if you get, a symptom, isolate for 14 days. So we took the club and we treated it as if it was one of our members. And we self-isolated the club for 14 days.
And what was the situation for the staff through that period? How did they react? 2, did any staff end up actually getting infected or catching the virus as a result of this visit? And what's been the consequences for them over the last few months?
I think we were blessed. None of our staff picked it up at all, and that was just fantastic. But I think this has probably had a bigger impact on our staff than any of us because they're not as deep in the loop as the rest of us, always ahead. I think we went from uncertainty of what was happening those first few days to fear of, do I have a job? Can I pay my mortgage? Through to understanding why we did it, because one of the things I've been committed with since I've gone back to Mounties is that open, honest, transparent approach to everything. And I think they understood why we did it, still mixed with a bit of fear. And then there was the appreciation when they realised that that weekly wage was still being put in their bank account, even when the club was closed, because they mattered as much as anyone. So I think they went through that stage, but now I think, and I said it's been a good thing in a way, I actually think they care more about each other than they ever have. I think it's brought a team much closer together and brought a culture that you try to build for years. I think it's brought that culture to the business in months instead of years, where they look after each other. The jokes are now that if Mounties ever closes, we're all going to Dale's for lunch. If we don't get paid this week, it's okay. We're all having vegetable gardens, in Dale's backyard. I think I had about 7 or 8 texts telling me, I hope you've got a spare bedroom, or we're coming camping at your house. It became a real team. We've always had that value, and I think a lot of businesses write values or boards write values and tell staff what they are. We've always had that value that when I came back, that our staff wrote our values, and they've always put family number 1. And I think it actually made it true, not just a word.
Yeah, well, clubs have always say that we're a community.
But it's not just the clubs, Gary. I had people reach out to me from my board, from my staff, to others in the industry, other CEOs, just to go, how are you? What are you doing? To some pretty special people for liquor and gaming saying, are you okay? What can we do? You know, we're here for you. It was pretty amazing. It's stuff that you would never have experienced otherwise. So I don't think it's just brought our club together. COVID in a way has brought the industry together, and not clubs, suppliers, legislators, regulators. I think it's brought us together, which is
well, because everyone was equally impacted, particularly first with the closure for 10 weeks that we had, and then the subsequent, you know, breakouts, alerts, lockdowns, etc. Everybody is impacted in some way or form. So I think it's not, we're all, you know, that saying's been used quite a bit in the last 10 months, but we are all in this together. How did your Mount Pritchard community respond, you know, to that situation? What's been the situation since you were able to reopen after you voluntarily closed yourself down again?
Interesting. We had some videos going on shutdowns and everything else, just aware. I think we're the only club that I know of, and I'm sure there's others, but we're the only club that I know of that membership actually increased when we reopened from where we were before. Because
wow.
I think a community finally got to a stage where they recognise the value that we do bring. They recognise that when we're not there is something pretty seriously missing. Yeah, we have 45 subclubs. For some of those people, that's self-inclusion. That's the people they get to see. Instead of going home and staring at four walls, that's their family, that's their community. You know, we work in one of the most multicultural areas in Australia, and you get those different cultures coming together. And I don't think until they miss each other and haven't got each other, how much they appreciate each other. So the support has been phenomenal, absolutely phenomenal. You know, we've gone from, I think it's about 140,000 members to 100,000. Visitation for us is still well down. Our business from December last year to December this year, so the 12-month period, we're down more than 50% in visitation. But it's not because of the COVID closure. It's because of the community, the normality, the changes in everybody at the moment.
Well, thank you very much, Dale. I've very much appreciated your insights, and I think it provides Darryl with a great intro, because he can also talk about it from a regional perspective. Being a club, Darryl is the CEO of Milton-Ulladulla, down on the south coast of New South Wales, and he had an experience, and I'll let him talk about it, I think in September. So welcome, Darryl, and if you'd like, you've got some slides I think you're going to show. If you want to put them up.
If I can make it work, that'd be good. How's that?
Yes.
Can you see that?
Yes, it's up there. Thank you, Darryl.
All right. Well, thanks for the invite. And I appreciate the opportunity to be able to share. Can I just sort of, I guess, reiterate a little bit what Rebecca and Dale have said, is that you know, this has been a learning curve for us all, and through the process, it's been probably the key for us in this result and coming up. What I'm about to run you through is the fact, you know, I spoke to people like Dale. Don't be scared to pick up the phone. I spoke to Paul Biddleston down at Batemans Bay, Tony down at Narooma, the guys down at Merimbula, because they'd all been through some form of effect due to COVID. And we sort of looked at, well, what happens if it happens to Milton-Ulladulla ex-servos, and what's our plan? So we tried to put a plan in place, and like Dale said, it doesn't always execute 100%. This process certainly helped us stay, or for me particularly, stay calm. And I guess we just followed the process, and we had a strategy around that. So my brief on this from Gary was to run you through what we did and how we got there. So I will try and do that as quickly and as painlessly as possible. By the way, Gary has got these slides and also all the templates that we use. So feel free to touch into him and use those templates at free will and change them as you please. Okay, so let's see if I can get this to work. Everyone see the second slide? That good, Gary? Excellent, thank you. So what did we do? Brainstorm a checklist is the first thing we did. This sort of came about firstly, the 5 local clubs in our area got together on a regular basis through COVID and said, well, you know, how are you guys going? What are you guys doing? What are we doing? And we checked in with each other to sort of say, well, okay, we're finding this is occurring and we need to do this and so forth. So it sort of resulted as a result from that. One of the key things I picked up from one of our colleagues was getting in touch with your local medical clinic. Some of us don't have our own doctors or our own medical clinics, so we need to rely on the local hospital or local medical clinic. And so we touched base and we'd organise, should this occur, who do I call and how quickly can we get a clinic set up for testing? Because as you know, when you close or you have to close, the quicker you get your staff tested, the quicker you can reopen. So that's probably one of the biggest things I would suggest you put in place, and also allow for a Sunday, which I didn't. So that was the surprise when it happened to us on the Saturday night. I went, but we can't do it on a Sunday. So we had to wait till Monday. So that put us back essentially 24 hours before we could reopen. So take into consideration, it can happen any time of day, and any day is a clear message there for me that I learnt from that closure. Cleaning checklist, we used the one off New South Wales Health and used that as a guideline, plus what information we got from other clubs. A lot of the information we took was from the New South Wales Health. We got together with 3 other clubs and we bought a fogger. We went thirds, and luckily enough, it was residing at my club. You know, it's almost like it was meant to be, but essentially we used that as part of the checklist. For anyone that doesn't know a fogger, it's a machine where you put the cleaning liquid in, dilute it as per the instructions, and you pretty much spray every surface in your building. And that's what that does. We pre-ordered PPE, cleaning suits, gloves, goggles, and disinfectant. So that was all on site, locked away in a certain cupboard. Should this occur, this is the only time it gets used. So we were comfortable that we had everything that we needed to commence the clean. Staff meeting was the next thing. Once we'd had all the processes and procedures in place and we were comfortable that this is what we would do, we held a staff meeting and sort of informed them, be aware if this occurs, touch wood, this is what will happen, and it may alter or change accordingly. So that was so you don't want your staff panicking, or as much as nothing goes to plan. I think if you have a plan, everyone feels that little bit more secure. I know I did. I'm just going to bring this up because that's not very clear. So I'll see if this works. Gary, just give me a thumbs up if this works. We trialed it before. So, all right, Gary? Excellent. So this is the COVID shutdown action checklist. And as you can see, it's done in a very fancy spreadsheet and very, very simple. It has an action after call from New South Wales Health, and the following process takes place. It has who, the document to cut and paste. So like I said, Gary's got these 6 template documents, and they obviously alter depending on the time of day, and there's certain things in there that are highlighted in yellow that you essentially need to make sure you change the date or the time. And then the step notes of that particular person. So the club closure decision had to be decided by my operations manager, Matt, or myself, depending on who got the phone call. And then we went through the process of speaking to the supervisor that was on shift, who got the phone call. We radioed all staff, do not panic, etc., because I can obviously see stuff's going on. Close the doors, make PA announcement, staff to the auditorium, etc. And we went through this checklist and called the appropriate people on the who column to say, we're into action plan and we need you on site. And for those that were at home, they actioned things from home. For example, Hannah was able to access Facebook and social media from home. And once I sent her the templates to post. So just simple steps like that. Make sure you test it if you're using it from home. You know, doesn't always work, but have a backup plan if it doesn't work. And that's the process we went through. So I'm not going to run through the whole thing. I just wanted to give you a quick idea We did our own deep clean. I know some clubs have coordinated cleaners that come in and do it, and we just went through our own process with that. And I think the mentality of the public being aware that it is a deep clean is the key terminology that we all use. So I'll just close that and happy to take questions on it afterwards. Let's go back to that slide. So what happened and how? So club supervisor got a call on Saturday night at approximately 6:20 p.m. Called me. They received a call about 6 o'clock. So you can imagine we're in the middle of service. You know, somewhere between 300 and 400 people in for dinner over that 3 or 4 hour period. Club's fairly busy on a normal Saturday night. My first discussion with New South Wales Health after I was briefed by the supervisor is that I would get a phone call very shortly. So I got that phone call at 8:30 p.m. So I sat in my office for approximately 2 hours, going through PR announcements, going through the documents that we prepared, calling the people that were on that checklist to say, if I call you or send you an email or a text, this is what will happen. Prior to all this, just from a board point of view, they're also part of that checklist, and we'll run through some of those key things. But the key thing for them was that they would get an SMS from me on their mobile is, we've had a call from New South Wales Health and I will be in touch with you as soon as I've sorted things out. But we'd already pretty much decided that the decision would be left to me whether we close or don't close, but 99% we were going to close. So I gave an instruction to close the club at 8:50 p.m. per our plan, made a PA announcement, which was part of that template document. The club was closed by 9 p.m. People vanished so quickly. It was amazing. I've never seen people exit that quickly. Yep, it was pretty, yeah. As you know, when you close before you're doing a fire alarm, you're tapping people on the shoulder off poker machines and saying, can you finish your beer? You've got to go. Well, let me tell you, by 9 o'clock, yeah, we were empty. So COVID-19 closure plan was then put into place. New South Wales Health had their COVID list of all our patrons by 9:15. So I know that there's a QR code now. Back then we were doing everything through our swipe entry. All staff were told to get tested through our clinic, and they were sent a link where they could log in for an appointment, fill in their details, and with the clinic, how we pre-arranged it. That managed to get the staff through the clinic every 10 minutes. So all the documentation filled out online, register appointment, getting there. Matt and I were already booked at 8:30 should this occur as the first two. So we were done by 8:40 so we could get our tests the earliest, and we could get back to work and work on how we were going to reopen the club. So those little things will buy you time and they will make the process quicker. Deep clean, the length of time we were closed was only 4 days. We were prepared for 14. Well, when I say prepared, we were prepared to be closed for 14. We prefer not to be closed for 14, I can assure you. But it was dependent upon the results that came back. So those that were close contact, I'd had 90% of their results back, which was 20 of our 85 staff. I'd had 90% of their results back within 24 hours of the closure. So we're pretty much comfortable to say that if the close contacts aren't coming back positive, let's get the place clean, let's reopen. So we then put out to the staff that had got positive, negative test results back. Anyone that wants to come and help and clean to get us open, please let me know via our deputy communication system. And we were inundated with responses from staff, which is part of what Dale was saying. You know, they want to get back to work. They want to look after their place of work as much as we do. So that was a good end result. And we were reopened by Wednesday, the 23rd. So the key message from me is preparation, preparation, preparation. Documentation that we had prepared was a club closure announcement. So like I said, Gary has all these. The deputy announcement, which is our internal mechanism for communicating with staff, was already pre-drafted, written. A direct SMS to the directors so they're aware of what's going on. The other important one that we did was also just to let our fellow club managers in our area, so in a country town, and probably the same thing in the city, but word travels pretty quickly. Our Facebook page just went off the Richter with communication likes and comments like never before. You know, you can put $10,000 up as a badge draw, but let me tell you, you put COVID up on your Facebook site and it's getting hits. So that was a key tool for us, is letting the managers know what's going on. So as they're getting phone calls, they can make sure they deliver the appropriate message to either their directors or their staff or their patrons as well. Website, Facebook and Instagram posts. We had a banner prepared for out front with a certain part that we just put a sticker over for the time and dates. And then again, staff deputy posts for COVID testing process. So we found those things were the key things to put in place. Additional communication that was not prepared that we learnt from is a staff deputy post for isolation as per New South Wales health instructions. Staff are looking for direction. So, you know, do I have to isolate? Do I not have to isolate? Do I come back to work? What are we doing? A staff deputy post that determines whether you're a casual or a close contact. And, you know, there's lots of speculation. Like Dale said, you know, we know where the patron's been by process of elimination, by date and time, where they visited, member, non-member. You can narrow it down pretty quickly. And if they're from a certain suburb in a certain town, it narrows it down to, you know, 2 or 3 people. They're in your club for 3 hours, bingo, it was X, Y, Z. So that process can be done, but you can't tell them that you've got the CCTV footage and you know exactly where he's been because they know better. But I think that's one thing for us all to learn, that we could potentially run someone through that CCTV footage and say, maybe this will help you eliminate the process quicker so that we can all get back to some form of COVID normality quicker. But like I said, we're all learning, and I think we're obviously getting better at it. The close contact, casual contact is important so that staff know what's happening. Also inform the medical clinic who is a close contact and who is a casual contact based on the list that you've got. That's an important tool for them because then they can prioritise those tests for you. Yep. Staff deputy post, i.e. payday, really important. They want to know what's going on with their pays and whether everything's being processed or not. So they are probably the key things that we've added to our list. Additional communication, that is important. And we did most of our communication via social media, and we found that that's how it got out around the town. Club was not required to close. New South Wales Health said to us, it's up to you. So we solely made that decision with the board when we went through the checklist. That would be left with me, but 99.9% we would close because at that particular point, I think it was the right thing to do. If it was to happen again now, I think we'd close, but we'd reopen quicker, if that makes sense. Yep. And again, depending upon the test results. Deep clean is taking place. Let your patrons know that you are cleaning. And, you know, a picture tells 1,000 words. If you have a look at our Facebook page, you will see people in full PP uniform. They're up cleaning screens, the guys with the fogger spraying it everywhere, and there's staff everywhere just wiping, cleaning. I think perception pictures are great. Let them know that all the staff are being tested. I think that's important so that they know when they re-enter that all the staff have been tested. The area of the club that actually affected, so they know if they've been in that place, they know what times. As much as New South Wales Health put the information out on their website, I think your patrons and your members will look to you for communication in reference to, you know, what's happening. Let us know what times, TAB Sports Bar, between these hours and this hours. If you are here, please go and get a test for the safety of everyone in the community and yourself. Yep. Club's priority, safety. Let them know what your priority is. We did a draft, I guess, communication that says, you know, we're doing this because of our staff, because of our members and our guests and the whole of the community. We believe this is the right thing to do. So this is just an example. I don't know how well you can see it, but this was essentially the draft PA announcement. I'm not going to run through all of it. Like I said, there's sections in yellow. Gary has these. They can forward them on to you. And then essentially is you need to alter or change it a little bit depending on whether it's morning or evening or so forth, and whether it's the weekend or not with the dates. And then this was the, I guess, the final cut version that I amended on the night and altered slightly. But having that ready for me is great because I just go bang, 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 read it a couple more times and went, that's ready to go. So that's it, Gary. Hope that helps.
That was fantastic, Darryl. Thank you very, very much, because there are still a lot of venues who've watched this happen to others but aren't exactly involved themselves. So having both your experience and Dale's experience and understanding of how these things happen and how the staff respond and the community respond, I think is very useful indeed. And as Darryl has said and Rebecca has said, their presentations are available, plus all the other associated documents that Darryl's talked about. So you just need to email me and we'll get that sent to you if you'd like a copy of it. But on behalf of all the listeners, viewers, thank you to Rebecca, to Dale and to Darryl for your presentations. It's been fantastic. I'll just load up my slide again so that you can see the contact details of the people concerned, their email addresses and their phone numbers. If you'd like to make contact with any of them, if you've got any further questions or comments that you'd like to make, please do reach out to them. We very much appreciate that experience that you've provided and that detailed information, all three of you. So thank you very much. And our webinars are now on a monthly basis. So we intend to have these webinars running on the first Wednesday of every month, right, at 1 p.m, the first Wednesday of every month. So if you want to mark that down in your calendars, that's when we'll be having them. And we'll let you know a couple of weeks out the topic of the next webinar that we're preparing for you. But on behalf of the RSL and Services Clubs Association, thank you to our presenters and thank you for listening and participating in our webinar. Today's webinar has been recorded and you'll be sent a link for you to download. But if you don't get the link or if you can't find it, just go onto our association website and they're all listed there. All the ones from last year plus today's are there if you wish to view any of our webinars. We record them all and store them on the website for you to download and watch at your pleasure. Thanks again, everybody, and thank you to our presenters once more. And I look forward to welcoming you again on Wednesday, the 3rd of March. Thank you.